Welcome to the Cystic Fibrosis Foundation CF Education Day webcast, Partnering for Improvement. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. This webcast is hosted by the Foundation and supported through an unrestricted educational grant from Genentech. To hear information about CF-related diabetes, CF clinical research, lung health, lung disease, infection control, and healthcare coverage, please watch an archive webcast on the Foundation's website. You can also hear from different members of the CF Care team about how to partner for improvement under Partnering for CF Care. This presentation, you will hear how adults with cystic fibrosis work as full members of their CF healthcare team to improve CF care. I encourage you to talk with the staff at your center and work to partner for improvement. Joining me to tell how they've partnered together to improve care at their center is Denise Wold and Sandy McAllister. Right. Denise is an adult with cystic fibrosis and serves on the Adult CF Center's Advisory Board. Sandy is the nurse coordinator and at the Adult CF Center at the University of Minnesota. So welcome Denise, welcome Sandy.
Thank you.
So let me start off with, what does partnering for improvement mean to you?
Well, it means partnering with our healthcare provider to make changes in the processes, make them better, and what hoops they have to go through, what it takes to initiate change, and the limitations that the healthcare provider have with the systems.
So what is quality improvement? Because I know that term is used a lot.
Quality improvement is a team approach to examining a process and looking for inefficiencies or inadequacies. Then our team flowcharts the process, looking for areas that we can make change. Once we identify some areas of change, then we proceed with that change, measure results, and if we achieve our initial goal, then our project's complete, and if we do not achieve our initial goal, then we continue to make changes and improve upon the process.
So, from both perspectives, I want to hear from both of you. How did you get involved in improving care at your center? How did you get involved in quality improvement? Sandy, let's start with you.
Well, back in 2003, we were invited to participate in a quality improvement course with some other CF Care Center teams, and we were each assigned a project and to carry out that project. Our project was to improve our project was developed to improve or decrease the amount of time that it takes for the patient who's admitted to the hospital, decrease the length of time it takes for them to get their IV antibiotics and airway clearance therapy initiated. And so initially looking at the project, we had, there was anywhere from 6 to 18 hours that it would take for our patients to actually receive their IV antibiotics, and a little bit less time to receive their airway clearance therapy. So after examining the process and flowcharting the whole process of admitting a patient, we made multiple changes. We had many failures, but some eventual successes, and were able to actually achieve our goal of getting IV antibiotics in and airway clearance in within 4 hours of it being admitted to the hospital.
That's great. So Denise, what about, from your perspective, how did you get involved?
Well, I got involved because I had some of concerns like Sandy was talking about when I had been hospitalized. And she came into my room, and of course I voiced all of my concerns to her. And you know, she had mentioned that they had gotten involved with this QI process, and didn't really say much about it to me. And about 2 weeks after I was discharged, Sandy called me at home and said, would you be interested in joining our team? And I was ecstatic. I was, yeah, absolutely, because I'd really like to help get involved and make the processes work better. So, yeah.
Well, that's great. That's wonderful. But Denise, what are you going to tell somebody who's a little bit more shy or hesitant to talk to a healthcare provider about areas that might need to improvement? They don't want to take the risk because they're afraid that if they do, they're not going to get the same level of care that they got before. What are you going to tell that person?
I would tell them to, you know, be willing to ask the hard questions of your healthcare provider. And I think that, you know, your healthcare provider is going to be more than happy to hear that you've got concerns, and you might find out that there's other people that have the same concerns, so that would bring up the issue to them, and that they're going to say, yeah, maybe we really do have an issue here and we need to look into it. So I would say don't be afraid, you know, talk to your healthcare provider and maybe also be willing to give some solutions or something that you've seen might work.
Well, Sandy, what was it like to, as a healthcare professional, bringing in an adult with CF to talk about what areas need to be better at your center?
Oh, we were really nervous at first to invite any patients on our team. We just felt like all our inadequacies would be exposed, our shortcomings would be revealed, and that they would lose all self-confidence in us. And but that did not happen at all.
So, Sandy, explain what prompted you to ask Denise to join your CF healthcare improvement team. You know, what was the reasoning? Was it a team decision, or you just were like, you know, this would be a great thing to do? Explain that a little bit.
Well, at the time, I was an inpatient nurse coordinator, and Denise was a patient, and she had expressed some concerns about some of the processes in the hospital, like medications not being delivered on time, and there were a variety of different things that were occurring. And I knew Denise fairly well. I knew that she had worked in quality improvement during her during the time she was employed. And so it occurred to me a few weeks later, after she was discharged, that I should ask her if she'd be interested in being on our quality improvement team. But the other piece that Denise brought to this is that when she talked about some of the problems that we were having and the processes we were having problems with, she had some solutions, ideas for change and ideas for solutions, and that was the intriguing point. So I called her and asked her. She was quite excited about being part of our team, and she's been on it ever since.
And so, but what about the other healthcare professionals on the improvement team? What was their perspective when you were, you know, did you have a lot of discussions about asking an adult to join the team, or?
Well, it actually, during our quality improvement course in 2003 that we attended, it was suggested or recommended that we have patients on our team. And so to actually move towards asking someone to be our team made us very nervous. We were concerned that they would discover our inadequacies, all our shortcomings would be exposed, and that they would lose all confidence in our providers and our whole team. But that did not happen at all. Quite the opposite. It was very comforting having our patients. It was very, you know, we learned their perspectives of what it's like to be a patient with CF, and they shared all that very freely. And so it was really quite an advantage point for us. And now, having 3 patients on our quality improvement team has really they've become the advocates for the CF population at our center.
So, Denise, what was it like when Sandy asked you to join, and what has it been like for you to be a part of this improvement team and from what I'm hearing, a peer in improving care at your CF Care Center?
Well, when Sandy called me and asked me, it was, I was ecstatic actually. I just thought it was a great chance for me to share my issues, my concerns, and also help the CF team come up with possible solutions that I knew were going to affect me. And so why would you not want to be a part of that? And I absolutely wanted to be a part of that. And I think that's probably one of the most important things that I enjoy is giving my own perspective onto some of the things that they talk about on maybe processes that they're going to change, and how is that, you know, how is it going to affect me and possibly other CF patients. It's also been great for me to find out what's going on behind the scenes, the things that, you know, the CF team has to do in order to affect change. I have learned so much about what they do. I've learned stuff that I had no idea I didn't know. You know, and they say that is, you know, that is something that you find, you don't know what you don't know until you're part of that. How dedicated the CF team really is. I mean, not that I had any you know, doubts about the team, but every single one of them are there right along with you with whatever issue is going on, and it's quite nice actually. It's very nice. The other thing that I really enjoy is connecting with other CF adults and hearing what their concerns are, and also learning tips and tricks on what they're doing to manage their own CF issues. It's been nice. It's been a real learning experience and a growth experience for me.
So we've talked about advantages on both sides. What are some of the challenges that you've had to work on or have encountered in this process?
I think our biggest challenge is probably that we've chosen quality improvement projects that are just too big. We didn't know how to scale the project down initially. For example, one of our earlier projects, the second project we did, it was to improve BMI, our body mass index, in the adult with CF. And that just brings such a whole host of different issues that could be going on in a patient. So we really had to narrow it down and focus on a smaller piece. So now we worked on annual studies, how to get annual studies done annually, which measure nutritional parameters in patients. And so that was probably been our biggest challenge. And I think over time we have learned to make our processes that we're going to change start very small and make it very easy to measure and go from there.
Denise, what about you?
I don't know that there's been, for me, a real, problem or concern with the big thing. I think that we do is like what Sandy said is, biting off a whole big chunk of something and then how to break it down into something that we can actually work on manageably. And some of these projects take a couple of years to get through. So yeah, that's probably been our biggest challenge.
Well, and that flows very well into a question, how long does quality improvement, or how long does it take from when you start a project until you see a measured outcome results of change? What kind of time frame are we talking about? Are we talking about days, weeks, months, longer?
Years.
Yeah, I think we've done maybe 4 big projects over the last 7 to 8 years.
Yeah.
And they take a couple years to do the flow charting process. We meet monthly, and so we flow chart the process, and then we invite people from different disciplines who might not already be on our team to join us and learn their process and how they're involved in whatever we want to change. And so it can take a long time just to flow chart and understand the process before we make any changes.
So the last question, last bit of advice, and I'm going to start with you, Sandy. What advice do you give to anybody watching that they can do to help partner for improvement at their CF Care Center?
I think the most important thing they can do is to talk to their provider or anybody on their CF team and ask them if there's a quality improvement team within their system, within their CF team, and if not, within their medical care system that they can get involved in.
Denise, what about you?
I would go along with what Sandy said, and if the patient's willing to bring up issues to their healthcare provider, talk to them first and see where they can go from there. If there is a QI team within the center or where they're at, the CF Foundation has a website with all kinds of information out there on what you can do and how to get started. So I would encourage those with concerns to go out there and take a look at it.
So thank you, Sandy. Thank you, Denise. This was great information about how one team has really worked to partner and improve care for adults with cystic fibrosis. You can learn more about the quality improvement section of the website that Denise talked about on the Foundation's website under Living with Cystic Fibrosis. Click on Quality Improvement. This gives you access to the Quality Improvement Toolkit that provides information about how to partner with your care center as well as ways to start conversations with the care center or with the hospital administration. The toolkit gives you detailed information about how to start an advisory group, ways to reach out to your care center staff and administration, plus success stories from other care centers who've worked to partner for improvement with CF Care. This concludes our CF Education Day webcast on Partnering for Improvement. I would like to thank you for watching, Denise and Sandy for sharing their story with us, Rick Vasta and the technical crew, Melissa Chin, Genentech, and the Cystic Fibrosis Foundation for making this webcast possible. Thank you.